Hello everyone, welcome back to another Facebook Live session on cancer care by American Oncology Institute. And the topic of our discussion today is nuclear medicine, and we have with us Dr. Arivan Ramchandran, who will be talking about nuclear medicine. And before we start this session, allow me to introduce Dr. Arivan. He is originally from Pondicherry, and currently he is with us as a nuclear medicine consultant at American Oncology Imphal unit. And before joining us, he was working at Shanti Mukan Hospital in Delhi. And Dr. Arivan has completed his MBBS in 2019 from JIPMER, Pondicherry. After that, he completed his MD from PGI MER Chandigarh in 2022. He has also won a gold medal in neurology in 2019 at JIPMER, and he was also awarded for the Best Research Paper Award in G.J. Strauss Conference in 2016, and in October this year he was also awarded for the Best Research Paper at AOFNB, which was held in Jordan. And he has also done oral and paper presentations at various international conferences. So welcome Dr. Arivan, and it's a pleasure to have you here today. So my first question for Dr. Arivan is what is nuclear medicine and what are the different parts of nuclear medicine?
To put it in simple terms, nuclear medicine is a subject, it's similar to radiology, where we inject radioactive materials into patients which will go accumulate in certain organs depending on their properties, and based on that we can assess the function of that organ. We can know whether something is wrong or something is reduced in a certain organ with the help of these radioactive materials, and we can image them, and so we can give results based on which the clinicians can make decisions.
Okay.
Yes. This is what nuclear medicine is about.
Okay.
And the nuclear medicine is broadly classified into two categories. We have a gamma camera here and a PET-CT scans, so which we will be talking about later in further questions.
Okay. All right. So moving on to the next question, what is nuclear medicine used for, and are there any special preparations or precautions to be taken before a patient undergoes any nuclear medicine scans?
Okay. So nuclear medicine, as I said, has two components. One is PET-CTs and one is general nuclear medicine. PET-CT is predominantly done in oncological cases, that is patients with cancers. So it is mainly used to know whether the cancer has spread to other parts of the body or not, which is called staging. And the PET-CTs can also be used for planning treatment, whether radiation treatment has to be given or chemotherapy has to be given. It can also be used to check whether the patient is responding to a particular treatment or not, whether the chemotherapy is working, whether we need to change it in the further course or we need to continue the same treatment, whether the radiation has worked or not. All those we will be able to know with the help of a PET scan. Apart from this, PET scan can be used in various other diseases, like if you can't find a source of infection, it can be used to find a source of infection. It can be used to estimate heart viability, which is more technically, I won't be able to explain it here. And gamma cameras, they are mainly used to image specific organ systems. Mainly we use it here to image kidneys, whether to see they function properly or not, and whether are they draining properly or not. The main function of a kidney is to drain urine, so we can check whether it is doing that properly or not using the help of a gamma camera.
Okay.
And the precautions, as you asked, for gamma cameras the preparations vary, but usually they don't require strict precautions like a PET-CT. For PET-CTs, we use something called F18FDG, which resembles a glucose molecule. So glucose is something which you get from your food. So since it resembles it, the cancer cells take up those glucose molecules and can be imaged. But the precaution that you have to take is you should not have food for 6 hours. You should not take anything other than water for the 6 hours period of time, and you should avoid taking insulin or diabetic medications if you are a diabetic person on that particular day of scan. Okay. These are the main precautions that you need to take. before undergoing any PET scan.
Okay. So the third question that I would like to ask you is, are there any side effects to nuclear medicine scans, and could you tell us more about the risk factors that are involved in nuclear medicine imaging?
That's a very good question. So frankly saying, there are minimal risks to nuclear medicine because it involves radioactive material which will expose you to radiations. But those radiation levels are very minimal. We as human beings receive radiation from the external environment. What we do in nuclear medicine is a bit higher than that. But for an example, a PET scan will expose you to 25 microsieverts. Yearly cutoff given by the government is 5000 microsieverts. So you can see the ratio. It's very small. It's almost equal to negligible. But pregnant ladies and young children, pregnant ladies are completely contraindicated for a nuclear medicine scan, since the growing child can get radiation from these sources and their growth can be affected. And in children, we try to reduce the radiation dose by giving lesser radioactive materials to them.
Okay. All right.
But even then, those are very negligible and you don't have to worry much.
Okay. And what are the common radioactive isotopes that are used in nuclear medicine scans?
Okay. In our institute, we use mainly two radionuclides. That's how you call a radioactive material. One is F18 FDG. Another one is F18 PSMA. F18 PSMA is a new molecule which is mainly used in imaging prostate cancer patients. These are PET scanner agents. The other radioactive material we use is 99M technetium, which is used in gamma camera. Like I explained earlier, like for imaging kidney scans, we do a DTPS scan. All those things will use radioactive materials made up of 99M technetium.
So how does nuclear medicine help in chemotherapy or radiation therapy?
Oh yes, that is also a very good question. So many people won't know the importance of PET scan because they don't know how it will change the further treatment protocol. So basically what we do is, we will image the patient whole body and we can tell the clinician whether the disease is increasing or decreasing with the given treatment, so that he can decide whether he can proceed with the same treatment or he can give another treatment, or to stop the treatment and refer the patient to some surgery, or the patient has to be referred to radiation. All those can be decided with the help of a PET scan. Not only that, PET scan can also detect other problems related to like general conditions of the patient, and we can give clinical clues to the attending physician so that he can treat the patient better in a whole manner.
Okay. And could you tell us more about the latest nuclear medicine facilities or scans that are available at AOI Imphal unit?
Okay. So currently we have started doing MOGA scans. MOGA scans are like a better way of finding out the contractibility of the heart, like what we call as ejection fraction. It is a bit better than echo in finding the ejection fraction of the heart. That we started doing here recently. And one more thing is, we started doing PET guided biopsies here. What PET guided biopsies, how it is different from CT guided biopsies is, usually in a cancer, some cells will be inactive, some cells will be active. So if you take a biopsy from an inactive part, if you take a part of the inactive part, the result won't be positive. So what we aim to do is, we will take biopsy from the active part, which we will be able to visualize using a PET scan, and then we can get a more positive result. The accuracy will be better and the yield will be better of a biopsy.
Okay, alright. So the last question that I would like to ask you, as we all know, the cost of cancer treatment, it can be very expensive depending on the drugs, depending on the duration of treatment. So a lot of people here depend on CMHT and PMJY health cards. So can CMHT and PMJY beneficiaries avail this facilities nuclear medicine scans?
PET scans are covered under CMHT and PMJY. so it can be done under the cover. But other scans are not covered. Apart from that, except for Assam, AOI Imphal is the only unit which has PET scan centers and nuclear medicine scan facilities.
Okay.
We are almost the second front runners in the northeastern region, and people should utilize and get treated better.
Okay, all right. Okay, so with that we have come to the conclusion of today's session. So thank you, Dr. Arivan, for your valuable insights and making us understand nuclear medicine better. And also thank you to all the viewers. If you have any queries, you can post it in the comment section or reach out to us in Facebook Messenger.
Thank you, Vini.
Thank you.